Good evening. Good evening, all the panelists and the participants. Today is the 78th issue of our INOC DigiConnect webinar, and we have been trying our level hard to sustain the efforts every week at 6:30 p.m. And as we all know that on 14th of November is the World Diabetic Day, and in this regard, we are having a great panel discussion on how to take forward the this COVID care, how we are taking care in our industries, and what are our efforts as an association that also we need to discuss. So uh, for the information to all the participants, this panel discussion will be followed by COVID Epid updates, and panelists are Dr. Rajiv Kumar Jain, who is Vice President of our AUSD, and he is Senior Consultant Health in Indian Railways, New Delhi, with 40 years of experience in health and hospital administration. He is also Fellow Award of Indian Public Health Association and Fellow of AUSD also, and he has published more than 145 scientific papers in national, international conferences and journals and books. Another panelist is Dr. B.K. Singh. Dr. B.K. Singh is Senior Consultant in Department of Medicine, Northern Railways, Central Hospital. He has done his MD from Banaras Hindu University and more than 25 years of practice, guide and teacher to DNB candidates. And previously, he was DNB coordinator at Northern Railway Central Hospital. And he has published a lot of articles in Journal of Association of Physicians of India and Scientific Secretary to Indian Railways Health Services. And he is also member executive body Delhi chapter of API. Another young panelist with us are Dr. Vikram Rajput, Medical Superintendent, Overhaul Division from Hindustan Aeronautics Limited, Bangalore, and he is alumni of Karnataka University, Dharwad, passed his MBBS in 1997, and in 2013 he completed a one-year course in diabetes, namely certificate course in evidence-based diabetes mellitus through PHFI, New Delhi from Fortis Hospital, Bangalore, and then completed his AFIH in 2018 from ICMR, Bangalore. Presently working as medical superintendent in Hindustan Aeronautics Limited since 2011, taking care of 2,000 employees. Previous to this, he has worked as medical officer with ONGC Hospital, Dehradun. Another learned panelist is Vishraj K. Mahaleshkar, and we have seen his academic acumen over last few years, and he is senior manager medical and SHE department from Goa Shipyard, Ministry of Defense, Goa, and he has been awarded Young Research Travel Award at 93rd annual meeting of Japan Society of Occupational Health Conference for International Session 2020 Japan, and he did his MBBS from Goa Medical College, Goa in 2011. He did his master's in hospital administration from Tripura, and he is also associate of fellow of industrial health, and he did this certificate program in health safety and environment from Public Health Foundation of India. So with this learned panel with us, young industrial physicians and senior colleague like Dr. Rajiv Kumar Jain, will have a lot of interesting deliberation about diabetes, because now nearly 500 million people are currently living with diabetes mellitus worldwide, and we all need to take care of this diabetes people, because otherwise it could rise to 700 million within next 25 years as told by WHO, and this potentially debilitating condition can lead to life-threatening complications when left untreated, and it can lead to early death. So as industrial physicians, it is our prime duty to take care of diabetics in our respective organization. And 14th November, as it is celebrated as World Diabetic Day, and it is a largest diabetic awareness campaign. So in this regard, we have requested all our learned panelists to deliberate on this issue. Before we start this panel discussion, may I request Dr. Rajiv Kumar Jain sir to throw some light on this World Diabetic Day and the diabetes problem which is there throughout the globe, so that we can set the stage for the panel discussion, sir.
Thank you, Dr. Sandeep, for giving me this opportunity to open the session on the eve of World Diabetes Day, which is so important that mankind's future depends on that. And if we see the climate and diabetes, it is the problem which is the future. Diabetes and climate are interlinked. And as we discuss, you will know much better. Could I have the first slide, please? So, the World Diabetes Day also celebrates 100 years of discovery of insulin. 100 years, and how easy it is to get insulin, or how difficult it is to get insulin, and how prices have not gone down over the years of insulin, determines the theme for not only this year, but for the next 3 years. The theme shall remain access to medicines and care, and what we should be doing. So before we start, I would like you to have a look at the video of showing how access is so important. So let's first see the video, and then we shall see the main issues related to the theme of this year and the next 2 years. So it's a 3 years project which IDF and WHO have taken up.
The day I was diagnosed with diabetes is a day I will never forget.
When I was diagnosed, I was just 15. I was like a teenage girl. I wanted to go out with my friends, enjoy life, and explore and expand. And diabetes made life very limiting.
Since I was initially diagnosed, my life changed radically. My parents were shocked and they decided to hide it from my relatives and friends.
I knew nothing about diabetes, didn't know what was happening in my body. Why am I feeling like this? Why am I not well?
Diabetes was something that I knew of and ran within my family, but it was something that was a big change for me. And I think I took it seriously for a short time, and then it just kind of went up and down over time.
Diabetes is almost like a permanent newborn where you constantly have to give it attention. You don't get a break from it, it's 24/7. So you're constantly thinking about what actions and things would impact your sugar levels and how that would make you feel.
Diabetes changed my life totally, because I had to change my eating habits, the way I eat and when I eat.
But having a physical exercise routine makes me more healthy by improving my overall health condition. It helps me to lower my blood glucose, helps me to reduce the chance of having cardiovascular conditions or renal impairment.
Diabetes care improved my life a lot. At first time, I was not aware of about a healthy life, but after coming under the treatment as a type 1 diabetes, I got counseling and education, health education, diet education, and motivation for a quality life.
I am very, very pleased that the care that I have received has helped me manage my life, and I think diabetes care has grown to be much quicker, much more effective, and much easier for the person living with diabetes.
Access to diabetes care has given me absolute freedom to live my life and to be as healthy as possible for as long as possible, so that I can just have as much time here looking after this little one and watching her grow up.
Go severely down. I think access to care improved my life in terms of giving me the power to care for myself, to have diabetes-specific needs met, and it had a positive, I think, outcome on my mental health.
The access to healthcare changed my life because I did not need to worry, and I have my medication at hand. It's there, and it changed my life because I feel better.
In our rural area, beyond the city areas, they have no availability of counseling, education, or others.
A lot of people do not have access to care, and it's quite a challenge to find test strips, insulin, supplies, sensors are out of the market.
Some people have access each 3 months, but some people do not have access to an endocrinologist at all in their whole lives.
The only thing that has been a challenge has been more cost than anything.
I think the biggest thing now is to make sure that access to the basics like insulin and blood glucose monitoring becomes available for everyone in the world.
So if not now, when? That is the question. And that question needs to be answered by all the people in the world, all the governments in the world in the next 3 years. The story begins in October 1920, when Frederick Banting has kits for insulin research. He's got the idea. November 20, Banting meets John MacLeod. May 20, 1921, Banting begins experiments assisted by Charles Best. August 1921, Banting and Best first used extracted insulin to regulate the blood glucose for dogs with severe diabetes. December 21, 1921, it's not 2021, it's more than 100 years back. December 1921, James B. Collip joins the research team to help purify the crude insulin extract. And January 1922, the first successful insulin injection is administered to Leonard Thompson on January 23. October 1923, Banting and MacLeod are awarded the Nobel Prize for the discovery of insulin. Next slide, please. Decades of innovation to provide care. In 1924, first specialized insulin syringe. 1954, first disposable glass syringe. 1955, first oral medication for type 2 diabetes becomes available. 1965, first blood glucose test strip. 1971, first blood glucose meter. 1979, first commercial insulin pump. 1982, human insulin introduced. 1985, first insulin pen. 1996, analog insulin introduced. 1999, first continuous glucose monitoring, that is CGM system. In 2000, first islet cell transplantation conducted, and in 2013, first artificial pancreas is developing. So this year, for the next 3 years, International Diabetes Federation and the World Health Organization, World Diabetes Day will be 3-year campaign to increase access to diabetes care and highlight the need for more action to prevent diabetes and its complications. Next slide, please. 14 November. So all the monuments in the world, the blue color, the light blue color will be the color for the World Diabetes Day. When you visit Gateway of India or India Gate, all the monuments will be lighted light blue on 14 November. United Nations Awareness, it is a United Nations Awareness Day, originally launched in 1991 by the IDF and WHO in response to the escalating health threat posed by diabetes. It aims to be the leading platform to promote diabetes advocacy efforts, promote the importance of taking coordinated and concerted actions to confront diabetes as a serious global health threat, and draw attention to the key issues and keep diabetes firmly in the global public and political spotlight. Next slide, please. The theme, as I told you, is if not now, when? Access to diabetes care. 100 years after the discovery of insulin, millions of people with diabetes, as you saw in the video, around the world cannot access the care they need. People with diabetes require ongoing care and support to manage their condition and avoid complications. We are living in extremely extraordinary difficult times in which people with diabetes are facing an additional major health threat. Regrettably, we have seen that people living with diabetes can be more susceptible to the worst complications of COVID-19. We should worry that the legacy of the pandemic will see resources and attention focused on infectious diseases to the detriment of all non-communicable diseases, including diabetes. We therefore cannot wait any longer for diabetes medicine, technologies, support, and care to be made available to all that require them. The centenary of discovery of insulin presents a unique opportunity to bring about meaningful change for the more than 460 million people living with diabetes and the millions more at risk. United, the global diabetes community has the numbers, the influence, and the determination to bring about meaningful change. We need to take on the challenge. It's time for the governments, policymakers, and advocates to act to increase investment in diabetes care and prevention and ensure everyone living with diabetes can access the care they need. If not now, when? That's the question. Next slide, please. The day also comes at a time when the world continues to live through the COVID-19 pandemic, which has not only resulted in a high proportion of people with diabetes among hospitalized patients with severe manifestations of COVID-19 and among those who have succumbed to the virus, but has also led to severe disruption of diabetes services. So this shall remain the theme for the next 3 years. Test trace blood glucose meter technologies, which are essential to have continued diabetes care. Next slide, please. The complications, heart attack, stroke, kidney failure, blindness, lower limb amputation. And can you imagine 1 in 10 people around the globe have diabetes? 10% of the global population has diabetes. That is the scale of diabetes. Next slide. Over 700 million people are expected to be living with diabetes by 2045. 3 in 4 people with diabetes live in low and middle income countries like India. Half of all people living with diabetes are still undiagnosed, 50%. 1 in 2 people who need insulin cannot access or afford it. Next slide. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Prevalence has been rising among more rapidly in low and middle income countries than in high income countries like India is a low income country. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In 2019, diabetes was the 9th leading cause of death, with an estimated 1.5 million deaths directly caused by diabetes. A healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, and regular screening and treatment for complications. So simple. Next slide, please. Diabetes, of course, as you know, is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. Hyperglycemia or raised blood sugar is a common effect of uncontrolled diabetes, and over time leads to serious damage to many of the body's systems, especially the nervous system and blood vessels. In 2014, 8.5% of adults aged 18 years and older had diabetes. In 2019, diabetes was the direct cause of 1.5 million deaths, and 48% of all deaths due to diabetes occurred before the age of 70 years. By contrast, the probability of dying from any one of the 4 non-communicable diseases, cardiovascular, cancer, chronic respiratory disease, or diabetes, between the ages of 30 and 70 increased by 18% globally between 2000 and 2016. Next slide, please. Type 2 diabetes, formerly called non-insulin dependent or adult onset diabetes, results from the body's ineffective use of insulin. More than 95% of people with diabetes have type 2 diabetes. This type of diabetes is largely the result of excess body weight and physical inactivity. Symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. Until recently, this type of diabetes was seen only in adults, but it is now also occurring increasingly frequently in children. Next slide, please. Type 1 diabetes. Type 1 diabetes, previously known as insulin dependent or juvenile or childhood onset diabetes, is characterized by deficient insulin production and requires daily administration of insulin. In 2017, there were 9 million people living with type 1 diabetes. The majority of them live in high-income countries. Neither its cause nor the means to prevent it are known. Symptoms include excessive excretion of urine, polyuria, thirst, polydipsia, and constant hunger, weight loss, vision changes, and fatigue. These symptoms may occur suddenly. Next slide, please. The third, gestational diabetes. Gestational diabetes is a hyperglycemia with blood glucose values above normal but below those diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening rather than through reported symptoms. Impaired glucose tolerance and impaired fasting glycemia is a serious issue. Impaired glucose tolerance and impaired fasting glycemia are intermediate conditions in the transition between normality and diabetes. People with IGT or IFG are at high risk of progressing to type 2 diabetes, although this is not inevitable. Next slide, please. Look at the health impact. Adults with diabetes have 2 to 3-fold increased risk of heart attacks and strokes. Combined with reduced blood flow, neuropathy in the feet increases the chances of foot ulcers, infection, and eventual need for limb amputation. Diabetic retinopathy is an important cause of blindness and occurs as a result of long-term accumulated damage to the small blood vessels in the retina. Close to 1 million people are blind due to diabetes. Diabetes is among the leading causes of kidney failure. Next slide, please. Prevention is simple. By simple lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should do only 4 things, 4 simple things. Achieve and maintain healthy body weight, be physically active, doing at least 30 minutes of regular moderate intensity activity on most days. More activities required for weight control. Third, eat a healthy diet, avoid sugar and saturated fats. And fourth, avoid tobacco use. Smoking increases the risk of diabetes and cardiovascular disease. It's 4 simple things to prevent. Next slide, please. But diagnosis and treatment is also important. Early diagnosis can be accomplished through relatively inexpensive testing of blood sugar. Treatment of diabetes involves diet, physical activity, along with lowering of blood glucose and the levels of other known risk factors that damage blood vessels. Tobacco use cessation is also important to avoid complications. Interventions that are both cost-saving and feasible in low and middle-income countries, including India, include these 3 things: blood glucose control, particularly in type 1 diabetes. People with type 1 diabetes require insulin. People with type 2 diabetes can be treated with oral medication, but may also require insulin. Second, blood pressure control. And third, foot care. Patient self-care by maintaining foot hygiene, wearing appropriate footwear, seeking professional care for ulcer management, and regular examination of feet by health professionals. Other cost-saving interventions include 3 things: screening and treatment for retinopathy, which causes blindness; blood lipid control to regulate cholesterol levels; and third, screening for early signs of diabetes-related kidney disease and treatment. Next slide. What is been the WHO response? It provides scientific guidelines, develops norms and standards, builds awareness on the global epidemic of diabetes, and conducts surveillance of diabetes and risk factors. So global report on diabetes provides an overview of diabetes burden. WHO module on diagnosis and management of type 2 diabetes is important for all physicians to be aware of. It's a 35-page document. I'll show you the contents of this WHO module on diagnosis and management of type 2 diabetes, which all doctors in the industries must be aware of. It's simple and it's easily feasible to be implemented by all primary care physicians. Next slide, please. In April 2021, WHO launched the Global Diabetes Compact. It's a global initiative aiming for sustained improvements in diabetes prevention and care. In May 2021, the World Health Assembly agreed a resolution on strengthening prevention and control of diabetes. It recommends action in areas including increasing access to insulin, promoting convergence and harmonization of regulatory requirements for insulin and other medications and health products for the treatment of diabetes, and assessing the feasibility and potential value of establishing a web-based tool to share information relevant to the transparency of markets for diabetes medicines and health products. So that is the focus of World Health Organization, and it shall get more focus, more visibility in the next 2 years and 3 years. Next slide, please. So these are the three important references which everyone should be aware of. Next slide, please. This is what I was telling you, the WHO IDF module on diagnosis and management of type 2 diabetes with the title HEARTS D. It's a 35-page document. Contents on the right side, you can see it gives you the clinical manifestation of diabetes, diagnostic criteria, management of diabetes, prevention and management of complication of diabetes, criteria for referral to higher levels of care, monitoring of processes and outcome, and it has 2 annexures: protocol for treatment of type 2 diabetes with insulin and prevention, assessment, and management of diabetic foot. Next slide, please. I show you 2 simple pages from this module. This is the diagnostic criteria for diabetes, which shows you on the left very objective criteria for diagnosis of diabetes. Fasting venous or capillary plasma glucose of 126 milligram per deciliter, least costly but difficult with ensuring in the fasting stage. 2-hour post-load venous plasma glucose 200 milligram, 2-hour post-load capillary plasma glucose of 220 milligram, random plasma glucose of 200 or more, HbA1c of 6.5 and more, and it has all the explanation in a very simple format. Next slide, please. This is another algorithm, which is the protocol for control of blood glucose in type 2 diabetes. Very simple and implementable by all industrial physicians. I will give you the link and send you the whole document on WhatsApp so you can get a better view of the entire document, 35-page document. Next slide, please. So I'm grateful for the attention that you've given to this introduction on World Diabetes Day. Thank you so much.
Thank you, Dr. Rajiv Jain, sir, to set the tone of this campaign against diabetes, how to take care of the diabetics and how to take care of our workers in our industries. So now in this regard, now we will open up the panel discussion. First, let me ask Dr. Vikram Rajput, how you are taking care of your employees. What are your campaign plans in your organization regarding diabetic care, and how you wish to organize the events in next 2 to 3 years to take care of the diabetics in your organization? Dr.
Sandeep, thank you very much for making me a member of this panel. I would like to say that whatever was said by Dr. Rajiv, we are following everything. We have a periodical medical checkup every year in which we have all the parameters, fasting, PP, and HbA1c. Once we diagnose a person, then we send him to hospital for further reviews where he is checked by a physician. and the following medicines are recommended. What I have seen all over the years is, okay, treatment is there, everything is there. In HAL, we have everything they have. But the issue is there are three kinds of people. One who listen to you and they start the medicines and they will do their checkup on time. Then there's another one who will take 3 months to 6 months to 9 months to start their own medicine. And then they'll come to a conclusion, yes, I have to start. And a third one who do not want to do anything. They don't want to be labeled. This fear psychosis is still there and it's still going on. And the last, you can say 2 months, I'm doing periodical checkup for more than 300 people I've done. I've got, say, 30 to 35 diabetics, and nobody wants to get labeled. They're going for outside for a second check. So that, okay, either I tell them personally, you please go ahead, get checked, come again. You have 2 readings, we'll start something for you. So this is one issue what I feel in industries. Otherwise, I think HAL is doing a wonderful job. We have dietitians, we have physicians to look after, we have eye specialists. Everything is done as per the Act, Factories Medical Act. You have to check people. We have eye screening. Everything is done to the point. And at present, we have a lot of diabetics in our society. It's a HL society. And what else to put forward? I think we have done what actually is required. Dr. Sandeep?
Yeah. Dr. Vikram, I would like to ask you that this was about the periodic medical examination which you are routinely conducting. Okay. Any efforts towards screening and finding out the pre-diabetics, and how you are mobilizing the community to diagnose the pre-diabetics so that they can be made non-diabetics, or the diabetics who are diagnosed and they are on oral hypoglycemics, they can be reduced with their doses. So any efforts towards some programs you have started in your organization? Which
so
can...
we have I have a score in my division. We have 10 divisions here. One of division is overall. So I deal with around 2,000 people. In that, what I have done is I have developed a score which consists of age, BMI, waist, hypertension, diabetic, ECN, hypertension, family history, and all that. That score is presented to everyone. Once they come to the clinic, okay, we'll get their measurements done, calculate their BMI, and so on. This is one way of assessing what you said about. The second thing, what was that, Dr. Sandeep?
Any campaign to identify the pre-diabetics?
Campaign in the sense we have medical education. We conduct classes every monthly ones. We call consultants from outside hospitals. We have Manipal Fortis Hospital close to, and there's one Sakra Hospital as well. So consultants come, they give a talk on diabetes, hypertension, and the related issues. I also myself have a monthly class where we go ahead and discuss regarding what is the issues, what you can develop in the next 10 to 20 years. So people think, maybe not today, but when they really become diabetics, when they're really labeled, that's when they consider all this in a better way.
Okay, now let me ask Dr. Vishraj K. Mahaleshkar. Dr. Vishraj, you're working in like Goa shipyard, and you might be also having diabetic patients with you in your organization. So as Dr. Vikram Rajput told, there is a lot of complacency and the casual approach towards diabetes amongst the employees. So any efforts from your side to see the what Dr. Rajiv has also told, and we all know that diabetes is a very deadly disease if it is not taken care of. It can lead to a lot of complications. We have seen people, employees who had lost their eyesight, or there was some retinal detachments. Numbers were increasing in young ages. Then there were CKD and renal transplants. People were on insulin. So a lot of complication of diabetic foots, or even amputation of the forefoot and many other complications were there with the employees. So how to tackle with this casual approach in your organization? Can you guide us?
Yes. A very good evening, Dr. Sandeep Sharma, and all the panelists, as well as all the attendees. First, Goa Shipyard, I would just give you a brief overview how we are working. We are an organization with 2,000 direct employees, and we have their family members covered. Also, we have around 2,000 employees who are on contractual basis. So this is the population what we are looking at, a population of around 10,000 people. So in Goa per se, our population, our state population is 15 lakhs. And as per the latest reports which are out today from the Directorate of Health Services, we are having 1.5 lakh people who are diabetics. So directly we have around 10% of the population, that is the Goa state population, which is diabetic. Similar situation exists in our organization too. We also have an aging population, which is there since we are a very old shipyard. So we are having an aging population with us, and we are definitely having this issue of diabetes with us. So as far as diabetes curative services are concerned, we are having all the latest. Meaning we are trying to provide them with the latest sort of medications because they are getting a direct reimbursement. So there is no issue with providing the medicines, but compliance is a major factor. So the first thing what we are looking for is before starting any medicine or before basically going in even for a diabetic checkup, the first thing we're hitting on is awareness, because without awareness there will be absolutely no compliance from anybody. So we are trying to give a lot of awareness. We are having awareness sessions every month, especially only for metabolic diseases such as hypertriglyceridemia, then we are having for diabetes and for hypertension, basically cardiovascular diseases and non-communicable disease. So these are the places where we are putting all our efforts in initially. So once this is done, then we go into the next phase. That is, we go in for a PP checkup and a fasting glucose level, as well as a few HbA1c camps. So from here, we are trying to get the cases out. So initially there is awareness, then we go for detection, and then our curative measures. We are having a family polyclinic wherein there is an endocrinologist who visits once in a month. There is a diabetologist who visits once in a month. So we take services of all these people. We try to screen the pre-diabetics also, as well as the curative services for the diabetics who are there. And the next level, the next thing what we focus on is once these people are, we have a database wherein we have a certain group of people who are pre-diabetics and also as well as people who are diabetics. For diabetics, what we do is we go in hardcore for all sort of screenings, such as retinal screenings. We have types with ophthalmologists in our polyclinic where they come with their autoref machines, and then we screen for their retinal. If there are any retinal issues, we check for their vision. So then the next phase, what we are looking for is any ulcers. So there is awareness given for self-care. So people basically need to be aware that they have to take proper care of their monitoring of their sugar levels. They have to see that they examine their food, because most of the times diabetics lose their sensations below the feet, so then they are unable to see. And since Goa Shipyard is a industry wherein we are working with a lot of metals, with a lot of metal pieces, a lot of construction going on. So there are many chances that the people can be exposed to cuts and injuries even through their safety shoes at times. So these things we need to put it into awareness that this can be a issue if they are not tackled at an early stage. So awareness is what we are looking forward ahead. And the next, and also we are having a tie-up with the Directorate of Health Services. In our state, we are having the National Communicable Disease, Non-Communicable Disease Control Program, which is going on full-fledged. So we are also running hand in hand along with them. So if there are any cases that we're detecting, we are also trying to keep them in the loop, and also trying to get their services, their expertise to come to our organization, so that we can give a more awareness, and we can intervene much more harder with all these things. So these are the basic things what we are doing. So awareness is the major part where we are trying to this thing. And also as far as the insulins dosages are concerned, people are given a facility, like if anybody is on insulin, we are having a refrigeration facility where they can keep one of their doses over here at the workplace, so that there is no problem of transportation, or say no problem keeping the insulin at a particular temperature. So we are having a dedicated refrigerator at our workplace where we have labeled all the insulin pens, and we have kept so people can, during their lunch breaks or during their morning sessions, whenever they are working, they can come and take the insulin from there, and they can keep their dose, which is meant to be at home only, so that there is no this thing. And as far as oral hypoglycemics are concerned, there is not much of a compliance issue. But as far as insulin is concerned, we need to guide them initially. So we have all these people from various industries, meaning from the various medical reps who come. We make them demonstrate how to use the insulin pen, and when the people are using, we try to show them and guide them if there is any difficulty or any sort of thing. So these are the things what we are doing, and it's not that by doing this we can say that we are doing our best, but we are getting new and new cases because of our lifestyle, because of our sedentary lifestyle, our food habits, and all these things. A lot of cases are detecting. We're having young diabetics now coming up, because now what we're having is a wide range of population. Now we are having an aging population as well as the new entrants. There is a young group which are there. We're having diabetics even in the age group of 30s, 40s. So this is something which we are worried about, and which we are hitting very hard for this. So we are trying to have monthly awareness programs, monthly screening programs, screenings from the highest tertiary level care. We are having tie-ups with all the hospitals. So we try to getting their consultants to screen our people, so that there is, in case if a patient is not able to go during his duty time, so we are trying to get the doctor itself to our doorsteps and get them screened as far as possible. So this is from Goa Shipyard as far as diabetic care is concerned. As far as we have had a few cases of diabetic foot ulcers also, which had to be taken up for amputations. So these people are acting as case studies for us. So these are the reference studies. So if we are quoting these people or these studies, these cases before, so that there is some sort of a fear in the people, because if there are a certain lot of people who are, as Sir Vikram Rajput said, that they are just ignorant. They do not want to accept that they are diabetics. They do not want to accept any treatment. They feel that we are fine. We are not having any symptoms. But there are certain things what we need to show them in a hard way. So this is how we tackle such kind of people. Over to you, sir.
Yeah. So till now we have understood that from Dr. Rajiv Jain sir, that diabetes is a severe problem amongst everyone across the globe. Dr. Vikram Rajput and Dr. Vishwas, they have also told us that amongst industry also it is very common, especially amongst the young adults, and they are definitely tackling all these issues amongst their employees through awareness, through the camps, screening camps, and then providing all sort of medicines to them. Then even like Dr. Vishwas told that even they are providing refrigeration facilities at the workplace to give the insulin at the workplace, at least one dose of insulin. So yes, the fear need to be created amongst the masses, so that they can be more cautious about the diabetes. Now, Dr. BK Singh sir, can you open up your video? If you, Dr. BK Singh, you are available, na? Dr. BK Singh?
Hello, am I audible, sir?
Yeah. If you can put on your video, that will be very nice of you, so that we can interact. So a lot of issues were there, which were discussed.
Basically, I'm traveling from Chandigarh to Delhi.
Or you can.
There might be some connection
so,
problem.
So you might be hearing that a lot of issues with diabetes are there amongst the employees, and although the industrial pollution, they are taking care of all these issues. But regarding this oral hypoglycemics, now a lot of oral hypoglycemics are available in the market. Maybe they are acting on different parts of the body, and they have different mechanism of action. So in your practice, like what is the first line of treatment that you advise to the patients when if someone is detected with diabetes, and how they should take care and how they should monitor, and in case that first line of treatment is not working, then how they should proceed in managing with oral hypoglycemics? Dr. BK Singh. I think there is some problem with his audio and video. But anyway, we'll connect with him as soon as he is available. Dr. Vikram Rajput, I would like to ask you another question.
Yes,
That
sir.
yes, we are doing lot of things for our employees. Yeah, Dr. BK. Let him settle down, and then Dr. Vikram Rajput.
Yes, sir.
In addition to the employees, we have to take care of our children also. Amongst our children also, there's a lot
Yes,
of
sir.
bad habits like junk food, and a lot of screen time is there. They are having a lethargic now for last 2 years.
Last 2 years, sir.
The schools are closed. So because of inactivity and other things, they are putting on weight. And how we should tackle this student community, especially the children, to prevent this diabetes, because diabetes starts very early, and only when the insulin resistant level it grows and it becomes it crosses the threshold, then people become pre-diabetic or diabetic. So what is your take on this?
So, frankly speaking, sir, children don't listen to anybody. That's the one thing. Nobody will listen to anybody. My son does not listen to me. But I think the best way out is awareness at school level. So I think that is the best option we have. That is the only one thing I can think about at present, what will really help children. Second thing, India does not have laws to create, they don't have sugar laws. Say like the UK. UK has a sugar policy. They started in 2012, 2016 they implemented. They have all the products, food stuff, whatever they come in the market, it is 40% less sugar. Something like this we should develop in India. So I feel awareness as part of the school, awareness as part of the parents, one thing. Second thing, there should be laws in the country which will govern this. I think this is the best options we have. We should put tax on these people who give all these ads like biscuit ads, all the food stuff and everything. So these tax should be there on 1 gram of sugar, or how much tax we should calculate and put. Then this is one of the best ways I feel we can get rid of this problem at an early age.
Okay. Dr.
Okay,
BK Singh, you are available now? Some connectivity issues are still there. So,
he's traveling, sir. I think it will be difficult to connect.
Yeah, he's traveling. Anyway, Dr. Rajiv Jain, sir, in addition to what we have discussed, what are your takes, how we should proceed with this campaign across India, especially?
Yes, I think on the eve of World Diabetes Day, our attention, number one, has to be on the community, how to detect the maximum number of persons who are diabetic or who could be potentially diabetes. So the intervention should address that people should understand, to come forward to understand their own risk, their family's risk. Their family means the children, the parents, and the entire community around the neighborhood. If all of them realize that it is not only diabetes which is dangerous, having hypoglycemia, having excess lipid or excess blood pressure or risk of diabetes is also equally important. So we should have the resources to make people aware that they should make active effort to periodically detect their vulnerability to get diabetes or their potential to become diabetic, because the intervention lies there. Prevention, as I told you, is simple: by lifestyle changes, control of blood pressure, and active exercises, and nutrition. So we have to have these three interventions to address these three, meaning more active society, meaning there should be a kind of social movement to remain active. That's one. Second, the food that is available in the neighborhood should be of a nature which helps better nutrition, meaning less of saturated fats and food which has a low glycemic index, which should be available in the community around, like whether it's a factory or an organization which has a captive population, where neighborhood provides the resources for buying things for human consumption. Part 2. Part 3. Exercise requires motivation and sustained motivation. It's not a one-day issue. It's not a 14 November issue. It's a round-the-year issue. And it requires sustained effort. And last but not the least, a distinct, effective intervention to ensure that tobacco in whatever form should not be available in the residential areas and in the factories or around factories.
Right.
This effort itself will also prove so rewarding. If somebody is detected to have a habit of tobacco smoke or tobacco chewing, the person should be provided access to de-addiction.
Right.
That's one. Part 2, people who have diabetes, their management, meaning the person should understand it is not only the treatment which is important, but prevention of complications is equally important. How could you do prevention of complications? By monitoring the 5 things which can lead to complication. Number 1, kidney. One has to detect kidney damage very early. How to do it? Microalbuminuria is the first sign of impending kidney damage. So the services for microalbuminuria should be available. Second, if one has to detect the hyperlipidemia, one has to provide the service of lipid profile and intervention to manage whether through drug or non-drug. Third, one has to ensure that the blood pressure remains under control by regular monitoring. Slight deviation, again, non-pharmacological and pharmacological interventions are required. So ongoing treatment and prevention of complications requires a very multidisciplinary approach. Services of nephrology is almost a must, with regular fundus examination, not merely measurement of visual acuity, but fundus examination of people who have diabetes, so that you could detect abnormality early and intervene early, so prevent complications. Last but not the least, preventing disability, which requires early intervention for foot, that is nerve neuropathy, which requires services of a good physiotherapist and a person who knows what kind of footwear should be made available to individuals who have diabetes. So early intervention will make the person more productive, and each successfully managed person with diabetes is a showcase that how you can make the person very productive, and through that productivity you are ensuring the family's productivity and economic independence. This shows that the organization in which the person is working is committed to ensure that the person remains actually productive, not only through his work life, but also after the work life, because the real problems will come after his active work life. Post 60 years or post 55 years, when he retires, he will face complications. So this is a good marketing strategy. So right from young age, community, society, hospital, healthcare, groundwork, everything has to work together.
Right. So Dr. BK Singh, if you are available right now. Still some connectivity issues still there. Dr. Vishraj, can you tell us that during COVID-19, especially you might have seen that the people who are diabetic, when they suffered from COVID-19, especially their sugar levels, they went very high. And especially when they were on steroid treatment, so their sugar levels were, especially at that time, they were unmanageable, and a panic situation was there amongst the patient, amongst doctor also, how to control diabetes during that period. So your some experience, hand-on experience, how you manage those cases. So,
Sir, what you have said is exclusively a very practical difficulty what we had during that time, because most of the people were put up on steroids, as you all said, and most of them had high levels of sugars. The first difficulty was our lab, where we have a internal lab where we do the blood testing. So first thing is we made it sure that everybody tests their blood sugar levels. Because of COVID, nobody could move around. So we tried to get as many glucometers as possible. So this was the first thing. Maybe our management was very supportive to us. So we tried to get in a lot of glucometers first, so that people could be screened. So whoever was taking steroids, we made it necessary that they check their blood sugar levels at least 3 times in a day, so that we see the variations or the trends that are coming through. At time, hospitals facilities were not easily available. Physicians consultations were not very easily available. So we tried to get in telemedicine into practice. It was a very difficult phase. We tried to get WhatsApp consultations. There were some corporates who were very cooperative. So they tried to help us with all these things. We tried to get teleconsultation with all endocrinologists or physicians from all the hospitals, and with this we kept a chart of all their sugar levels, especially non-diabetics, because their sugars were the ones which are shooting up very high. People who were non-diabetics, their sugars were coming to somewhere borderline, they could be manageable, but the people who were already diabetics, who were on oral hypoglycemics or on insulin, we really had a difficult time to handle these cases. So what we tried to do is, first, monitoring was made very necessary. We tried to take everyday follow-ups. We kept a chart inside our dedicated nursing team was just doing a follow-up role of all these people. Whoever we detected COVID positive, first thing is, once their medicines reach them, we see that their medicines are taken on time. Once they are taken on time, we also see that their sugars and other parameters are monitored, like saturation, sugar, all these things were monitored on daily basis. We used to get a cumulative report at the end of the day, and then we used to prepare how next we go about the next day, meaning what next to be done, what dosage of insulin to be adjusted accordingly. There's a sliding scale to be used. So these were all technical difficulties, but because of technology, because of our cooperativeness through all our corporate hospitals and all our fellow doctor colleagues who were very helpful with the help of telemedicine and other things, we were able to kind of manage all these things, and definitely with a very strong support from our management, which came from the top. So health was definitely given a priority, and was the which we focus more on during the COVID time. That's it.
So in our organization, yeah. आपका आवाज ब्रेक हो रहा है सर. डॉक्टर बीके सिंह, we can connect when your internet connectivity is stable. So in the meantime, we can ask our other panelists who are there. If they have any question from the panelists, they can unmute themselves and they can ask questions from Dr. Shiva Ramakrishnan, sir.
Yeah, good evening.
Yes.
Now, I have 3 things to tell. One is, if you are managing diabetes, the patient is already a diabetic. If you are going to do a follow-up blood sugar, my request to all is, do the postprandial previous day and fasting the next day. Don't do it on the same day. You can do it on the same day if the person has his own glucometer. If he is going to a pathological lab, please don't do it, because Nobody fasts till 9 o'clock. So your reading will be wrong. And if you do the postprandial on the same day, then your whole routine changes. And please do not do post breakfast blood sugar. This can be used only for diagnosis. It cannot be used for management. Second very important thing is that please ask your employees who are diabetic to do a lower extremity Doppler every year. You can pick up early blockages which can be corrected and you can prevent gangrene. So I thought this, because I have found that even many diabetologists do not tell you to do postprandial previous day and fasting next day. So this was my advice. Thank you.
Right, sir. Thank you, sir. This all comes from experience only. And we thank you for giving all this new insight on how to go about with fasting and PP blood testing, blood sugar testing, and Doppler. Yes, it is very important because this gangrene of the foot, that is very common. And when it suddenly appears in people with diabetics, then it leads to a lot of complications and amputations and disabilities and other things. So we need to be more cautious about this particular issue. So what any other panelists, if we have any observation or question? Dr. Shyam Pingle, sir.
No questions. Thank you. It's going on very well. And I like the inputs which are given by Dr. Rajput and Dr. Vishwaraj.
Nice.
So they are very nice. What they are doing in the industry. Industrial medical officer can definitely play a great role in detecting at pre-diabetic stage and help in postponing the diabetes. We may not be able to avoid it completely, but we can certainly postpone the diabetes. And that should be our objective when we are working in the industry, because we have a cohort whom we can follow up regularly at our bed. Thank you.
Nice. Thank you, sir. Dr. Shashi, Dr. Sanjay Rotito, Dr. Tyagaraja, if you have any question, else I'll ask some other question from the panelists. You can unmute and you can ask because what we have learned from today's session, that although we are doing a lot of things, but diabetes is it is not a problem in itself. It is we have to see it very holistically, and we have to, it is the root cause of many other non-communicable diseases. Dr. Tyagaraja, sir, you are available? Yeah, you can ask any question or you have any observation if you have.
At the outset, it gives me great pleasure, Dr. Sandesh Sharma ji. It is one of the best panel discussion we had, and thank you very much for there is no question, because everybody has given their best today, and especially our Vikram Rajput has given our HL output very nicely. He has elaborated how HL hospital do this diabetes and all. The wonderful Vikram Rajput, very congratulations. Very nice. Thank you very much for your valuable suggestions. Thank you, Dr. Sharma ji. You have moderated very nicely. Thank you very much.
Thank you.
And our Rajiv Kumar Jain has given a wonderful preface about the diabetes, and really it is a worth this one. Thank you very much.
So, thank you, sir. To summarize, let me tell that diabetes awareness program is not a one-day affair. Like we should not forget that today is or on 14th is the World Diabetic Day. So we should celebrate on one day in our respective organizations and just forget about it. So this is a continuous effort, and we have to do it. This campaign, we have to take it forward as Dr. Rajiv has also told that this campaign is for 3 years, 21 to 23. So, but since many of our workers, employees, their dependents, they are diabetic, and even children, they are getting this obesity because of this COVID and restrictions. They are staying in home, and they are eating all sort of junk foods, not going to school, physical activities less. So we have to take care of the whole lot of people, and especially this COVID. Now it has deteriorated the diabetic conditions amongst the employees, and it has led to a lot of complications also during this COVID time. So what is important is how to take it forward as a group, or as an association, or a group of industrial physicians, how to take it forward. So number one is improve the education about the diabetes. So we are sorry that Dr. BK Singh is is unable to connect because he is traveling, but he had requested him because he's a good clinician, and he would have given a lot of insight. But we will continue this effort on diabetes in our next webinars, in which we will bring some clinical aspect also, because oral hypoglycemics, they are a big question. Which oral hypoglycemic we should start, when to start the insulin, when to give basal insulin, when to give other sort of insulin. So that is, this treatment clinical part is also very important, that we all should know. Though we should be a leading platform to promote diabetes advocacy efforts, and we have to access the quality of the care, that is also very important. And having a physician or a diabetologist on panel is not sufficient. We should have a neuro physician on our panel for taking care of diabetes. Then eye specialist is very important. Then as Dr. Shiva said, Doppler studies and many other laboratory facilities, they all should be quite efficient in order to diagnose, and in order to prevent further complication of diabetes. So we need to improve the quality of our lives by increasing the activity, as Dr. Rajiv Jain sir has told, and improving upon our diets, taking less hypoglycemic diet, and preventing the complications. So we need to disseminate this information amongst the masses, and we should create the fear about diabetes. Diabetes fear has to be there in the minds of the people. Then only we will have an effective control on the diabetes. And we need to draw the public attention to all these key issues in our respective organizations, and on the forums like Enoch DigiConnect webinar platform, which we have created, and organize the learn about diabetes events in the schools. As we have discussed with Dr. Vikram Rajput, we will organize some more programs in the schools also, in our respective organizations. Arrange for the activity at the workplace. This is also very important. We have to organize screening camps, blood sugar fasting. Yes, that was a very important take away from Dr. Shiva, that on first day you do the fasting, and next day you do the PP. And in addition to that, you also do the HbA1c for the diabetics. That will give you an effective overall control how it is going about the diabetes in that person. So now in these new norms, we have to make effective use of social media, create events for knowledge, detect pre-diabetics and diabetics, and create the support groups also wherever possible. And what is important is during this World Diabetic Day is wear blue. Wear blue, that is important, and for awareness of everyone. Blue circle is the universal symbol of diabetes, and it signifies the unity of global diabetes community. So we all need to be a part of this global diabetic advocacy community. And from Enoch DigiConnect webinar, we will be organizing much more than this. This was the launching pad, this panel discussion for today. And we will take this forward, and we would invite Dr. Vikram and Dr. Vishraj also next time, and with many more clinical physicians also on this, specialist, diabetologist, eye specialist, and nutritionist. We can call this even physiotherapists, who all can guide us how to take care of diabetes in our respective industries. So thank you all very much for this lovely panel discussion. Now, the second phase of this today's Enoch DigiConnect webinar is COVID Epid update, because we all know that COVID pandemic is still evolving. Still, Europe is gripped by this COVID pandemic, and a lot of breakthrough cases are there in many countries. And although in India the numbers are decreasing, but still our active cases are not going down. They are not going under control. So still a lot of people remain unvaccinated. So let us hear from Dr. Rajiv Jain sir, how to go about with during this COVID pandemic.
So friends, here we are again to review the epidemiological situation of COVID-19. Saturday evening of 13th of November 2021, and epidemiology of COVID-19 is evolving. As you will see, what is happening? The countries with very high number of vaccine people also having cases. Countries with very low vaccination status also having high number of cases. So what is the reason? Do we know that? We do not. So we need to continue to be doing epidemiological studies to understand as to what is happening on the ground in this pandemic. And when we say pandemic, it means global disease spread. It remains a definite pandemic of unparalleled severity. So to understand from the horse's mouth, the Director General of WHO and the technical lead, the scientific experts of World Health Organization, I'll show you a video which was transmitted by WHO yesterday evening. Have a look at the video where experts, the global experts speak.
Hello to everyone from WHO headquarters. COVID-19 is surging in countries with lower vaccination rates in Eastern Europe, but also in countries with some of the world's highest vaccination rates in Western Europe. It's another reminder, as we have said again and again, that vaccines do not replace the need for other precautions. Vaccines reduce the risk of hospitalization, severe disease, and death, but they do not fully prevent transmission.
Here with us in a room, we have...
We continue to recommend the tailored and proportionate use of testing, masks, physical distancing, measures to prevent crowding, improve ventilation, and more. And get vaccinated when it's your turn. Every country must constantly assess its situation and adjust its approach accordingly. With the right mix of measures, it's possible for countries to find the balance between keeping transmission down and keeping their societies and economies open.
Minatan, who is our chief scientist.
No country can simply vaccinate its way out of the pandemic. It's not vaccines or, it's vaccines and. And it's not just about how many people are vaccinated, it's about who is vaccinated. It makes no sense to give boosters to healthy adults or to vaccinate children when the health workers or older people and other high-risk groups around the world are still waiting for their first dose. The exception, as we have said, is immunocompromised individuals. Countries with the highest vaccine coverage continue to stockpile more vaccines, while low-income countries continue to wait. Every day, there are 6 times more boosters administered globally than primary doses in low-income countries. This is a scandal that must stop now.
I wonder what's WHO's view?
And even in the countries, we're seeing across Europe, across the world, transmission, is increasing. Transmission is driven by so many factors right now. The variants, increases in social mixing, which began months ago. The patterns that we are seeing across Europe, the patterns we're seeing across the world are entirely predictable. Because when you lift public health and social measures, when you lift the rules around masking and distancing and improving ventilation, avoiding crowds, in the context of variants, in the context of increasing social mixing, in the context of limited vaccination, you're going to see the virus thrive. And that's exactly what's happening right now.
It's about the 2 antiviral pills.
But to have a drug potentially coming down the pipe that can treat high-risk patients earlier in the course of disease is good news. But we wait to see the meta-analysis, we wait to go through the process. WHO will work with partners to ensure, under Marianne's leadership, that we have the safest and most efficacious products available, and then obviously trying to get to the point where they can be produced at a price that people can afford. So I think it's all going in the right direction, but we just need to move step by step in a methodical way.
Dr. Van Kerkhove, we will now call on...
And we are struggling to even maintain the most minimum of services right now on the ground. And the risks are growing. People are dying. People are starving. People are dying because of lack of access to the very basics of medical care. The very basic human right to life is now being lost. And it's an unfolding tragedy, and it's unfolding before our very eyes. And the world needs to wake up to what's happening.
So friends, epidemiological awareness, that is the awareness of epidemiology of COVID-19, is a must for all citizens and especially healthcare professionals, and all the more to all healthcare professionals. So let's see the current epidemiological situation of COVID-19. Well, I'll start with this path-breaking research publication. Covaxin data finally gets peer-reviewed. Covaxin, the indigenous COVID-19 vaccine developed by Bharat Biotech and ICMR, has 77.8% efficacy against symptomatic infections, 93.4% against severe infections, and 65.2% against infections by the highly infectious Delta variant of the SARS-CoV-2 virus. According to the vaccine, phase 3 trials published on Friday in the Lancet. A look at how it stacks up against other major vaccines. Covaxin's efficacy, 77.8%. Oxford Covishield, 76% efficacy. Pfizer vaccine, 91.3% efficacy. Moderna, 93.2% efficacy. Johnson & Johnson, 72% efficacy. Then Sinopharm, 78% efficacy, and Sinovac, 51% efficacy. And 2 vaccines approved in India, but awaiting nod from WHO, that is Sputnik V, 92% efficacy, and Zycov-D, 66.6% efficacy. The data with Bharat Biotech data has shown with 25,800 volunteers in 25 test sites across India. The efficacy analysis was done after the evaluation of 130 confirmed COVID-19 cases, with 24 observed in the vaccine group as against 106 in the placebo group, according to the Lancet article. So Dr. Balram Bhargava, Director General of ICMR, said the data speaks highly about the strong position of Covaxin among the other global frontrunners with respect to COVID-19 vaccine. The bench-to-bedside journey of Covaxin in less than 10 months showcases the immense strength of Atmanirbhar Bharat, along with the Indian academia and industry, in fighting against the odds and carving a niche in the global community. Is definitely a reason for India to celebrate India's scientific prowess. Next slide, please. This is the publication in Lancet, published on 11th of November 2021. The title of the publication is Efficacy, Safety, and Lot-to-Lot Immunogenicity of an Inactivated SARS-CoV-2 Vaccine BBV152, Interim Results of a Randomized Double-Blind Controlled Phase 3 Trial. And look at the number of authors, right from Rajesh Ella, Siddharth Reddy, and at the end, you find DG ICMR's name as well as Krishna Ella, wife of the owner of Bharat Biotech as well. It is the Covaxin Study Group, which is the author of this publication. And findings are very reflective of the robustness of the data obtained from these 25,798 participants who were randomly assigned to receive BBV152 or placebo. 24,419 received 2 doses of this vaccine or placebo, that is 12,221 vaccine and placebo 12,198. Efficacy analysis was dependent on having 130 cases of symptomatic COVID-19, which occurred when 16,973 initially seronegative participants had at least 14 days follow-up after the second dose. 24 cases occurred among 8,471 vaccine recipients and 106 among 8,502 placebo recipients, giving an overall estimated vaccine efficacy of 77.8%. In the safety population, 5,959 adverse events occurred in 3,194 participants. Bharat Biotech vaccine was well tolerated. The same proportion of participants reported adverse events in the vaccine group and placebo group, with no clinically significant differences in the distributions of solicited, unsolicited, or serious adverse events between the groups, and no cases of anaphylaxis or vaccine-related deaths. And the interpretation is Covaxin was highly efficacious against lab-confirmed symptomatic COVID-19 disease in adults, and vaccination was well tolerated with no safety concerns raised in this interim analysis. This is after WHO on 3rd of November already had approved this vaccine as competent for emergency use listing. Next slide, please. Now, the focus now switches to full vaccination after 1 billion feet. After India crossed the 1 billion doses mark in COVID-19 vaccinations, the focus has shifted to expanding the share of the fully vaccinated population. At present, only 1 in 4 Indians has received both the doses of either Covishield or Covaxin. There are variations across the states and union territories depending on vaccination coverage and consistency of growth. The group that tops the list is that of smaller states and union territories, that is Lakshadweep, Sikkim, and Goa, where at least 60% of the population is fully vaccinated. Among larger states, there are those that have consistently done well, such as Himachal Pradesh, Jammu Kashmir, and Kerala, where the share of fully vaccinated population ranges from 40 to 50%. Then there are states that started on a high note but did not maintain the pace. Arunachal Pradesh, Chhattisgarh, and Rajasthan were once among the top 15 in vaccination coverage, but have since dropped to the bottom 10. This has limited the fully vaccinated population share to 25 to 35% only. Assam, Tamil Nadu, and West Bengal, which picked up speed only in the last 2 or 3 months, have fully jabbed just around 25% population, while the bottom group is that of the states with the lowest vaccination coverage overall, such as Uttar Pradesh, Bihar, and Jharkhand, which have fully vaccinated less than 17% of their population. Worryingly, these three account for 29% of India's population. A recent study by Public Health England showed that Covidshield's efficacy against the Delta variant was 33% with a single dose and 60% with both the doses. Full vaccination is key to avoiding another wave. Next slide, please. This is the graph. 16 states and union territories have given at least 1,000 doses per 1,000 people. And Himachal Pradesh, Jammu Kashmir, and Kerala lead the large states in full vaccination. At the bottom, you see Uttar Pradesh, Jharkhand, Bihar, Meghalaya, Punjab, Nagaland, and West Bengal. Next slide. India slides to 6th position in vaccination coverage growth. Inoculation efforts have picked up significantly in Southeast Asia. The Philippines, Bangladesh, and Indonesia reported the highest growth in vaccination coverage last week among the most populous countries. Earlier this week, the Philippines received nearly 8 lakh AstraZeneca doses from Germany and 1 lakh Sinovac doses from China. The Filipino government is planning a 3-day national vaccination day drive at the end of November to boost its vaccination effort. Bangladesh has set up more vaccination centers for school and college students aged 12 to 17. It aims to vaccinate 40,000 students each day, up from 2,000 to 2,500 vaccinations at present. Indonesia plans to give a third booster shot after it has vaccinated 50% of the public. It has completely vaccinated 29% of its population. India has slid down to the 6th place from last week's 4th. This week, its coverage grew by only 2.1%. Next slide. We look at one state this week, that is Mizoram. Aizawl has 57% of total active cases in Mizoram. Mizoram, the 7th least populated among India's states and union territories, has the 6th highest caseload in the country. 7 of its 11 districts have test positivity rates of more than 10%. A positivity rate of more than 5% is an indicator that the spread is not under control. India's overall test positivity rate is 1.2% and has been less than 2% for the last 47 days. Sejship and Champhai districts have positivity rates of 21.2% and 20.2% over the past week, the 2nd and 3rd highest among all districts in the country. Aizawl, the capital district, has reported a positivity rate of 11.1%. It accounts for 57% of the total active caseload in the state. On the brighter side, Mizoram's weekly cases have been on a decline for the last 4 weeks. It reported 3,507 cases this week, down 15.4%. It has 5,939 active cases. It has partially vaccinated 58.7% of its population and fully vaccinated 43%. Next slide, please. Kerala has 9 of the top 10 districts with the highest new cases in the last 7 days. At 80,876 new infections in the past 7 days, India's weekly caseload has now fallen to its lowest in 9 months. The active caseload of 1,39,683 is the lowest in 264 days. Only 6 states and union territories reported a rise in cases, the worst being Jammu Kashmir, which reported 840 new infections. Kerala still accounts for almost 3/5 of the new confirmed cases. Thiruvananthapuram, Ernakulam, Thrissur, and Kozhikode are the only districts in India with more than 5,000 weekly cases each. Kerala's 1,929 deaths are 77% of the total deaths in the country. A total of 25 states and union territories reported less than 10 deaths over the past 7 days, out of which 12 reported none. The declining numbers threaten to bring in complacency. About 100 million people who have taken their first dose have skipped their second, according to the central government. Next slide. This is the weekly district-wise positivity rates, where these are the districts which positivity rates is more than 10%. Arunachal, Siang district, 33.3% positivity. Kerala, Wayanad, 13%, Kollam, 13%, Thiruvananthapuram, 12.93%, Idukki, 12.5%, Kozhikode, 12.3%, Kottayam, 12.19%, Pathamthitta, 11.34%, Thrissur, 10.7%, Ernakulam, 10.1%, and Mizoram. Look at this. Look at the position of positivity. Sarchip, Lungle, Nanthial, Champhai, Longthia, Aizawl, Namit, Saiha, all more than 10% positivity. And Nagaland, Thuensang district, 14.29%. So it is these districts which need focused attention in arresting the transmission, active transmission of COVID-19 in India. Next slide, please. These are the districts which show positivity rates between 5% and less than 10%. Arunachal, 1 district, Assam, 2 districts, Himachal, 2 districts, Kerala, 5 districts, Manipur, 5 districts, Meghalaya, 1, Mizoram, 2, Nagaland, 2, and Sikkim, 1, and West Bengal, Kolkata. All these districts are showing weekly test positivity rate of more than 5% and less than 10%. These districts also requires very intensive efforts to contain active transmission of COVID-19 in India. Next slide, please. Another new thing which happened this week was guidelines for international arrivals were revised, and this algorithm was released by the Ministry of Health and Family Welfare on 11th of November 2021. Significantly, children under 5 years of age are exempted from pre and post arrival testing. However, if found symptomatic for COVID-19 on arrival or during home quarantine period, they shall undergo testing and treated as per laid down protocol. And this is the protocol which everyone arriving in India from abroad should be aware of. Next slide, please. This is the Southeast Asia position where we reported 1,57,000 new cases and over 3,500 new deaths, a 13% and 29% decrease as compared to the previous week. This declining trend has been observed in the region for over 3 months. The highest number of new deaths were reported from India, that is 2,605, 33% decrease, Thailand, 22% increase, and Indonesia, 30% decrease. Next slide, please. COVID-19's epicenter again. Europe faces fresh reckoning. Europe has become the epicenter of the pandemic again, prompting some governments to consider reimposing unpopular lockdowns in the run-up to Christmas and stirring debate over whether vaccines alone are enough to tame COVID-19. Europe accounts for more than half of the average 7-day infections globally and about half of latest deaths. Next slide, please. This is the weekly COVID-19 position, global position from 1st to 7th November. A high slight upward trend, 1% in new weekly cases was observed with just over 3.1 million new cases. And WHO European region reported a 7% increase in new weekly cases as compared to the previous week, while other regions reported declines. Next slide, please. This is the overall data for the week from the WHO, where you find the European region showing 7% increase week on week and deaths 10% increase week on week. Next slide. This is the graph of the pandemic from the beginning, the global pandemic. As you can see easily, pandemic is nowhere under control. It is still a real pandemic, both in cases of confirmed cases and deaths as well. Next slide. Now you see the graph by WHO region. So you see the green expanding. Green is Europe. It is expanding very highly. Next slide. This is the graph of different regions, and you look at the green graph. What do you notice? A sharp upsurge of the fourth wave. And the fourth wave, instead of going down, is going up still. All of the regions showing downward trend, but America is still stabilizing. It's not near touching zero. Next slide, please. This is a graph of where I've shown the top countries, and look at the Russian Federation graph. It's going up, up, and up. And also look at the graph of Germany. Suddenly you find it's going up. Now it is no way. In fact, it is the highest wave now in Germany, higher than any other waves in the past. And UK graph is also showing a peak, or rather plateau at the top. And United States is still on a high plateau and going up. So pandemic is definitely raging across the world. Look at Turkey as well. It is again plateau at the top. A different graph, a different scenario, and nowhere near control. Next slide, please. These are the top 10 countries where cases newly reported last 7 days are there. United States, Russian Federation, United Kingdom, Germany, Turkey, Ukraine, Poland, Netherlands, India, and Brazil. Next slide, please. Top 10 countries with highest number of deaths United States, Russian Federation, Ukraine, India, Romania, Brazil, Mexico, Turkey, Bulgaria, and United Kingdom. And if you look at the last 24 hours, United States reported 1,350 deaths, and Russian Federation reported 1,235 deaths in last 24 hours. So this is the real pandemic in two of the richest countries of the world, United States of America and Russian Federation, very large countries. Next slide, please. This is the graph of 7 days COVID-19 cases per lakh population, and darker the brown the color, more is the prevalence of or incidence of new cases per lakh population, and you're finding Eastern Europe is the darkest color. Next slide. This is a 7 days graph of COVID-19 deaths per lakh population, and you find the darkest blue color in Eastern Europe. Most deaths there. Next slide. This is the prevalence of variants of concern for the 7 days. You find predominantly the globally Delta variant is prevalent at the moment. Next slide, please. Now I'll take you to three events which are going to happen in the next 7 days. One is 15 to 17 November. Do attend a free event for 3 days, WHO Global Evidence to Policy Summit. Evidence as a catalyst for policy and societal change towards more equitable, resilient, and sustainable global health. Next slide, please. These will be the speakers: Angela Merkel, Michelle Bachelet, Ban Ki-moon, Tedros Adhanom Ghebreyesus, and Dr. Soumya Swaminathan. All these will be speaking in evidence-informed health policy beyond the pandemic, organized by World Health Organization. Very important event, and it's free to attend online. It's fully digital event, and visibly you can participate in the top scientists speaking evidence to policy summit 15 to 17 November 2021. Next slide, please. A global network for evidence-informed health policy making, EVIPNet, Evidence-Informed Policy Network, will be the driving force from WHO for this summit. Next slide, please. A global launch of the Food and Agriculture Organization and World Health Organization Food Control System Assessment Tool will be there on 16 November from 12 noon, that is India time, will be 5:30 p.m. Food and Agriculture Organization and World Health Organization, you are invited to this free upcoming event to find out more about the recently developed FAO WHO Food Control System Assessment Tool. Next slide, please. It will introduce you to comprehensive assessment tool and increase awareness on the benefits of assessing a national food control system. It's a free event. Next slide, please. Population-wide interventions for reducing alcohol consumption. What is the per capita consumption indicator telling us? The webinar on 16 November by WHO is also worth attending. It will be at 3 p.m., which will be India time, will be 7:30 p.m. in the evening. So it's also a free event organized by WHO Regional Office for the Americas and Pan American Health Organization and European region of the WHO. Next slide, please. Another good event for the country organized by NIMHANS Bangalore is National Symposium on Cities and Mental Health. COVID-19 pandemic unfolded mental health crisis in the cities of India. So this will be organized by Department of Epidemiology, Center for Public Health, and Department of Psychiatry, Community Psychiatry Unit, and Telemedicine Center of Biocon Foundation and Dr. R.N. Murthy Foundation from NIMHANS. Next slide, please. This is also a free event. You need to just register and attend this event. This will be from 9:30 a.m. to 5 p.m. on 10th of December 2021. If you want to attend this, just visit NIMHANS website, nimhans.ac.in, and register. Next slide, please. I'm grateful for the attention that you've given, because attention is the rarest and purest form of generosity. Thank you so much for patient listening.
Thank you, Dr. Jain sir. So, COVID pandemic is still persisting, and since our panel is still there. There is one question from Dr. Ghanshyam Dulera. While treating diabetes, stress should be given on healthy diet, low carbohydrate, fats, regular exercise, anti-diabetic medication, which can not only control blood sugar level, prevent cardiovascular complications, renal complications, and stroke prevention, can reduce weight and reduction of mental stress by yoga, pranayam, and 8 hours sleep. Dr. This is from Dr. Ghanshyam Dulera from Navi Mumbai. Yes, all these points, they are well taken, and we need to be very careful during this COVID pandemic because still everything is opening up, and for last two sessions we had one panel discussion on vaccination. Still the vaccination coverage is not up to mark in India, although more than 1 crore population has been vaccinated by first dose, and testing also now, people are reluctant to get themselves tested, so we should still ask people to get themselves tested for COVID if they are having some symptoms which are concurrent with this COVID symptomatology, and we should not delay the symptoms because yes, lot of other similar disease they are also prevalent. Flu is now there, then even dengue is also there. So all these things they should be kept in mind. But uh, first and foremost is COVID, which we should keep in mind and get ourselves tested. And any other question from Dr. Vishraj, if you have from Dr. Rajiv Jain or Dr. Vikram? From
Yes,
Dr.
sir, I have a question.
Yeah.
The thing is, corporate social responsibility. All organizations all over India, they do a lot of things, but I have not seen anyone investing in diabetes programs, this non-communicable disease. I think we should talk over with our management and ask them to include this. This is one of the, I think, funds can come, which the government of India, if they're not able to arrange, I think this will help a lot through corporate social responsibility. I've seen always everyone donating through for eye operations, developing a village or whatsoever. But this point should be there in corporate social responsibility. One thing, that's it, sir.
Yeah, that is important that actually in CSR grants by the companies or the public sector or the private corporates. The problem is we can give grants to the projects. So
Okay.
we have to develop some project like what I told you. We can start activities of campaigning or awareness in the schools. So if some organization or some NGO or some organization they take this forward, then definitely CSR funds can be diverted towards that, because that will ultimately lead to control of diabetes and prevention of diabetes, because health is an important subject for grant of CSR funds. But only what is required is a proper project which need to be approved by the management. So funds definitely they can be diverted to these campaigns. So we should try in our respective organizations if we can create some programs like this. If we can, for schools we can have for some advocacy programs, if we can do for the surrounding villages or surrounding communities, or for our contractual workers. So some these funds can be definitely allocated. And I would also like to learn from you about this sugar policy in UK. Have you gone through this sugar policy? If you can throw some more light on this sugar policy. You have to unmute yourself.
Yes, sir. Yes, I had read today morning regarding this. I had read in the newspaper, say around 2012-13. It had come in the Times of India that they were trying to formulate a policy on this. But how they are also, it's government NGO together. They have started working on this to reduce this. This, I think, can be done in India also. But I don't know how far as an organization we can go as an IOH, IAOH or an AOHK Karnataka. So I feel this is the way. I don't think so. We are providing everything to everyone. All the treatment is there, but still people tend to get diabetes in spite of so much of knowledge and whatsoever in the newspaper. But I think this policy matters only will change on the top, then we'll see something in the future. Naito, it's like they're saying we'll have 700 million in the 24. Definitely will have, sir. There's no other way out.
So,
Dr. Rajput, I think this is an important area where public
sir.
policy intervention becomes important for managing diseases of this severity. Both hypertension, hyperlipidemia,
Yes,
and diabetes together can be managed by population-wide policy. Not only in UK, in India, the regulatory body, the Food Safety and Standard Authority of India, is has already started these interventions in regulatory framework. First intervention is trans fat control. We have promised by 22 with a zero trans fat. So gradually it's being shifted. So trans fat is being replaced in the food that is marketed. Similarly, the labeling. Currently, labeling is not mandatory. Labeling will become mandatory where the content is visible to the consumer in a very transparent way. If you go to US, if you go to European countries, you find the labeling is very strict. The consumer knows. Both ways the consumer is aware and labeling is transparent. The behavior change pattern in purchasing, which changes the markets towards better purchasing for healthier foods. But the earlier question that you asked, there is a national control program for non-communicable disease, and there is a distinct program which is known as National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke.
And
right?
CDS, yes,
So
sir.
in each district of the country, the office of the Chief Medical Officer, Chief District Medical Officer, has a nodal officer for this national program. If you approach him, there is a earmarked funds where project-based intervention, especially in organized sector, like you are working in Hindustan Aeronautics and Dr. Vishwaraj is working in Goa Shipyard, you can make up a proposal in tune with his requirements, where you can get specific funds, and funds are given for non-recurring activities, where you can get funds for equipment, manpower also, and HIS. Only thing is you have to provide him the data that how you utilize the funds and how effective your intervention has been. And that can help him in his performance of his duties, making better packages for the entire population of the state and the country in due course. Because this is part of National Health Mission. So there's a lot of flexibility. People like you actually will drive the innovations in our country, who have a specific population and population which is residing near the workplace. If you devise these programs, just go and talk to him and you will find ideas being taken up, and this will result in your reputation as an occupational health physician also rising up. CSR funds are additionally available, as Dr. Sadeep have already mentioned, for health lifestyle interventions. You can always tap CSR funds, not only your own funds, but funds from other PSUs and other organizations as well. From sister organization located in, say, Bangalore or located in Goa, where Goa Shipyard is located, you can tap their CSR funds into your own organization. Only thing is, when you utilize these funds, maintain accountability, show results, and you get more funds. Funds is never a shortage. The problem is people who manage these funds successfully. Any organization which manages CSR fund very well, they have no constraint of money. The only constraint is right people and right organizations which show genuine utilization and improvement in the health status of the population they cover.
Yes.
So, Dr. Vishraj, if you have something to say?
Just what we had mentioned about the CSR activities. So before pre-COVID, we had a tie with an NGO called as Voluntary Health Association of India, their Goa chapter. So what we did is certain part of our medical CSR, we had we had transferred funds to them, meaning that was our NGO which was implementing the programs for us. So we had all these schools to be covered under this program, and also remote areas where medical facility was not available. So we had a dental screening van, we had a medical checkup van, which is to go to remote interiors of Goa. So there are certain areas of Goa where the primary healthcare facilities are not approachable. So meaning there are places where the people have to. These are in the extreme ends. Meaning on the borders between Goa, maybe Goa and Karnataka, or maybe Goa and Maharashtra. So those places where primary healthcare facility is not easily prevalent, or not easily accessible. So we try to cater to these areas. Since Goa is a very small state, so we try to hit on all the borders of the state. With these, we had two vans exclusively for medical CSR, and one man was for dental CSR. So we used to send these people, and also the same NGO we utilized for our school health programs. So this way we could screen a lot of diabetics as well as anemics and also. So we used to do their routine blood counts, or certain things, basic tests, their lipid profiles or their BP. These basic things are absolutely not accessible to these people who are living in remote areas. So we try to give some support to the public health system in Goa, meaning that is a primary health care system through our CSR. This was pre-COVID. Since COVID, we could not continue it further, but we did run this program for almost 5 years, from the year 2012 till 2017 successfully. Then we had started with the next league again. That's a repeat program, but now because of COVID, we had to kind of lower down. But slowly we are getting back again on track with this program. So we are coordinating, since Goa is a very small state and Directorate of Health Services is very compliant with our this thing. So we are going with their support for other programs also.
Yeah.
That's it from our side.
Yeah. So as industrial physician or occupational physician in our respective industry, we have to envisage some programs. So once we envisage the program, we identify the problem, identify some problem, what is there, and envisage the program, and management will definitely come forward to allocate funds, whether through CSR or through regular funds. That is not a fund is not an issue. I'll give you one example. Like Dr. Vishwas has told, in Indian Oil Corporation, we are transporting petroleum products through TT crew, tank truck trolleys and trucks. So all these drivers, they have to undergo a long journey with this tank truck crew, bullets carrying LPG, and they have to travel a long journey. So many of them, they are diabetics, and being diabetic, they might be having some refractory errors, and they might be having some like hypoglycemic episodes also sometimes. So what we did, we conducted screening camps for our TT crew. So once we conducted this TT crew this camps, we found that many of them, they were diabetics, and many of them, they required even insulin. So and there were a lot of refractory errors, although this driving license they get through the RTO, that is just a eyewash. But if we see them regularly on every year basis, then they do have some problems. So we can envisage these problems, why these roadside accidents are occurring, or why these fatigue problems are there amongst the TT crew. So we under these camps, we organize these programs, and we tested their vision, we tested their sugar, we screened them. Then accordingly, we provided them with medications, even the glasses to them under CSR. Then we even provided free cataract operation camps for them. Then even who were requiring, they were taking insulin, they were provided food, and they were provided, like whenever they have to go for a long journey, they were provided free food which they can carry along with them, because there won't be any resting place in between, or some place to have their food like dhaba and other things. So when they are going for a long journey, we provide free food to them when they start from the terminal. So these are the things which as a business person we need to envisage. We have to find out some real problem, why traffic accidents are occurring, why roadside accidents are occurring, and what it can be the root problem. So as a occupational physician, we can guide management. So funds will definitely come if we hit the right target. So we have to do a lot of campaigns. We have to do a lot of groundwork before management comes out for supporting our activities. So a lot of great discussions today, and definitely we will take forward this journey for another 2-3 years to so that this diabetes problem, at least it should be under control. Two more panelists are there, Dr. Shashi Bhushan or Dr. Kishore Parekh, our Joint Secretary of IUH. And if you wish to say something, sir.
Yeah, Sandeep. On the symbolic date, that is World Diabetes Day, that is on tomorrow. It is very excellent choice, at least by you people. That is one thing. Second thing, it was excellent update and very informative session. At the same time, as usual, our respected Rajiv Jain sir update and his research work is excellent. And every time, every Sunday, his update session we enjoy. So it is excellent session today, both diabetes as well as on the COVID updates. Thank you.
Thank you, Dr. Parekh, sir. Dr. Shashi, if you are available, because you were traveling, or else we can conclude the session. It was a long session. Now it is almost 8:30 for
Yes, sir.
2 hour session. So thanks to all the panelists. We will call you again for panel
Yes,
discussion on
definitely.
different issues. Because we want young industrial physicians to come out and speak about what they are doing in the industry and
Yes.
get some good inputs from seniors like Dr. Rajiv Kumar Jain sahab, and we all association people and we all seniors, we all are there with you all to guide you and to provide you support. And what we require is your active participation in this forum so that we can take forward our journey of sharing and learning with each other. This session will be it is recorded and it will be live telecasted. It is being live telecasted also. It will be available on our Enoch DigiConnect YouTube channel. Already 130 subscribers are there. You can subscribe it and you can see it at your leisure how you have interacted with other panelists during this session.
And today's video is on 102nd video.
Yeah.
Oh,
And
yeah.
Dr. Vishwaraj is really breaking new ground. Congratulations.
Thank you,
You
sir.
are definitely
Thank you,
doing
sir.
wonderful work in Goa shipyard.
Thank you, sir. Thank you so much. And thank
Dr.
you.
Vikram, really, you are helping India achieve the true Atmanirbhar Bharat. Both
Yes,
Goa
sir.
Shipyard and Hindustan Aeronautics and Indian Oil are true
Yes, sir.
reflection of Atmanirbhar Bharat.
Thank you, sir. And
Thank you.
thank you all the panelists and all the learned participants for sparing the valuable time.
Thank you for giving us an opportunity, sir. Thank you, Dr. Dharma, sir, and Dr. Rajiv Jain, sir, for giving us this opportunity.
Thank you. Thank you very
Thank
much.
you. Thank you. Good night.
Good night.
Thank you. Good night.